Hello all, this is Jen with Heroes Path Palliative Care. I just wanted to talk with you today a little bit about what palliative care is because there's a lot of confusion even among healthcare professionals about what that means. So pediatric palliative care is provided to a child facing serious illness and their families. It's provided with a variety of team members such as a doctor, nurse practitioner, nurses, case managers, child life professionals, social workers, clergy, anything that is going to help these children have the best quality of life. So this is going to support all aspects of their care. For children who have serious illness, they often have a lot of pain and symptoms that are very troubling to them, and so the palliative care team will help them try to manage those symptoms and that pain in an effective way so that they can have quality of life. The palliative care team can also help provide care management and decision-making assistance, and they can help them coordinate all of their care across various specialists and various states even, so that everybody on the healthcare team that's serving this child can effectively serve them with the child and their family's goals in mind. So today what I really want to talk to you about is the most troubling of these things for families, and it's the pain and symptom management aspect. For a year, my 3-year-old son had severe chronic pain. The only medications that doctors felt comfortable prescribing were over-the-counter Tylenol and ibuprofen. But several doctors mentioned that the amount of pain he was in would be debilitating. If it was one of us adults, we would not be able to get out of bed, yet he managed to continue several therapies a day and tried his very best to live like a normal toddler. We did everything we could to distract him from his pain, but he spent most of his time groaning and grimacing, grabbing his legs, elbows, feet, head, and belly, crying inconsolably often. He still would manage to smile and play with his siblings, but his pain made him struggle to walk and left him rolling on the ground, crying often. I watched my son suffer immensely for a year before he died, and although he had a palliative care team in another state, they could not prescribe the medications he needed across state lines. And there were no doctors found that felt comfortable managing those medications here in New Mexico. I think there's a misconception that any doctor should be able to provide pain management, but the truth is that the children who have severe chronic pain often have multiple systems involved, and it may not be clear what exactly is causing the troubling symptoms. Also, these children often have many medications, and doctors are not sure how new pain medications will interact. And many of these children with complex medical problems can have reactions to medications that are opposite of the intended result. So a medication for anxiety may cause more anxiety. With so many considerations, only special training and the experience that palliative care doctors have can help sort out the appropriate treatment as quickly as possible. Because there are no pediatric palliative care programs outside of the hospital setting in New Mexico, families like mine are left with few options for pain and symptom relief. The doctors and specialists here care deeply about this need, but have no pediatric palliative care resources to reach out to for help unless they go out of state. And again, these medications cannot be prescribed across state lines. Children should not have to be in intense pain. They do need this extra support from a palliative care team, and the specialists who provide for these children greatly desire this extra layer of support as well. We as parents just want our children to have smiles and laughs and play like other children. So we want to replace that pain with that smile. We want to be one of the first of many palliative care programs for children, and we want to start providing those services in the home setting where children are most comfortable. You can help us start our program by donating to Heroes Path Palliative Care. We would love to start our services as soon as possible because there are hundreds of children in New Mexico right now who need help with severe pain and symptom management. You can be a part of starting this trailblazing effort to provide services for these children. I know that it's hard to believe that children can be in such great pain, but they are. And so we ask that if you can possibly help, that you do. Thank you so much for your time. Bye.